What is MRI? MRI is magnetic resonance imaging is a non-invasive imaging technology that produces three-dimensional detailed anatomical images. It is often used for disease detection, diagnosis, and treatment monitoring. It is based on sophisticated technology that excites and detects the changes in the direction of the rotational axis of protons found in the water that makes up living tissues. How does MRI works? MRIs employ powerful magnets which produce a strong magnetic field that forces protons in the body to align with that field. When a radiofrequency current is then pulsed through the patient, the protons are stimulated and spin out of equilibrium, straining against the pulse of magnetic field. When the radio frequency field is turned off, the MRI sensors are able to detect the energy released as the photons realign with the magnetic field. The time it takes for the proton to realign with the magnetic field as well as the amount of energy released changes depending on the environment and the chemical nature of the molecules. Physicians are able to tell the differences between the various types of tissues based on these magnetic properties. To obtain an MRI image, a patient is placed inside a large magnet and must remain very still during the imaging process in order not to blur the image. Contrast agents often containing the element gadolinium may be given to a patient intravenously before or during the MRI to increase the speed at which protons realign with the magnetic field. The faster the protons realign, the brighter the image. What is MRI used for? MRI scanners are particularly well suited to image the non-bony parts or soft tissues of the body. They differ from computer tomography CT in that they do not use the damaging ionizing radiation of X-rays. The brain, spinal cord, and nerves, as well as muscles, ligaments, and tendons are seen as much more clearly with MRI than with regular X-rays and CT. For this reason, MRI is often used to image knee and shoulder injuries. In the brain, MRI can differentiate between the white matter and gray matter and can also be to diagnose aneurysms and tumors. Because MRI does not use X-rays or other radiation, indeed it is the imaging modality of choice when frequent imaging is required for diagnosis or therapy, especially in the brain. However, MRI is more expensive than X-ray imaging or CT scanning. One kind of specialized MRI is functional magnetic resonance imaging (fMRI). This is used to observe brain structures and determine which areas of the brain activated, consume more oxygen during various cognitive tasks. If it is used to advance the understanding of brain organization, offers a potential new standard for assessing neurological status and neurosurgical risk. Are the risks? Although MRI does not emit the ionizing radiation that is found in X-ray and CT imaging, it does employ a strong magnetic field. The magnetic field extends beyond the machine and exerts very powerful forces on objects of iron, some steel, and other magnetizable objects. It is strong enough to fling a wheelchair across the room. Patients should notify their physicians of any form of medical or implant prior to any MRI scan. When having an MRI scan, the following should be taken into consideration. People with implants, particularly those containing iron, should not enter an MRI machine. Noise, loud noise, commonly referred to as a clicking and beeping, as well as sound intensity up to 120 decibels in certain MRI scanners may require special ear protection. Nerve stimulation, a twitching sensation, sometimes results from the rapidly switched fields in the MRI. Pregnancy. While no effects have been demonstrated on the fetus, it is recommended that MRI scans be avoided as a precaution, especially in the first trimester of the pregnancy when the fetus organs are being formed, and contrast agent, if used, could enter the fetal bloodstream. Thank you.